So we have approximately about 20 people from our ಕುಟುಂಬ. ನಮಸ್ಕಾರ ಎಲ್ರಿಗೂ. ಮಂತರಿಗಳ ನಮಸ್ಕಾರ. ನನ್ನ ಹೆಸರು ಸುಧಾಕರ್ ಮಟ್ಟಿ ಅಂತ ಹೇಳಿ, ಬೇಸ್ಡ್ ಔಟ್ ಆಫ್ ಶಿಕಾಗೋ. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ಇಸ್ ಪಾರ್ಟ್ ಆಫ್ ಅವರ್ ಮಂತ್ಲಿ ಹಿರಿಯರ ಚಾವಡಿ ಆರೋಗ್ಯವಾಣಿ ಹೆಲ್ತ್ ಸೀರೀಸ್ ಅಂತ. ಈ ಉದ್ದೇಶ ಇಸ್ ಹೆಲ್ತಿ ಕುಟುಂಬ, ಹ್ಯಾಪಿ ಕುಟುಂಬ ಅಂತ ಹೇಳಿ. So we feature our own Kutumba physicians and experts in the medical profession during our health series, just so that we have and maintain and sustain that Kutumba connection. And that's, of course, one of the value add from our Shivali Kutumba to our community. So this program happens monthly, the second Tuesday of each month. And today I have the opportunity to welcome Dr. Meera Shreedhara. She is in the Dallas area, and she also practices in the Dallas area. She has been in this profession for more than 15 years, a very active participant in the community as well. And thank you, Dr. Shreedhara, for sparing your time with our Kutumba participants and educating us on the topic of cancer today. So Ivattina Karikrama will focus on cancer, and we'll learn more about this topic and perhaps some mitigation opportunities as well from a cancer perspective. So without further ado, I will turn this over to Dr. Shreedhara to take us through the next 35 or 40 minutes. So on the housekeeping rules, please mute your phone, turn your video off, and we'll have about 15-20 minutes for a question and answer session. Please post your questions in the chat, so it gives an opportunity to moderate the questions to Dr. Shreedhara. Again, please take the opportunity to put your questions in the chat, and we will take as many questions as possibly we can before we wrap this call up at 8:30 p.m. Central Time. So again, without further ado, thank you, Dr. Shreedhara, for your valuable time, and of course, to our Kutumba members for sparing your 1 hour of this fine Tuesday evening on this important topic. Over to you, Dr. Shreedhara.
Thank you very much, Sudhakar Avre, for your very kind introduction. ನನ್ನ ಹೆಸರು ಮೀರಾ ಶ್ರೀಧರ ಅಂತ. I'm a medical oncologist. I've been practicing in the Greenville area. So ನನಗೆ it is a great honor for me actually to be here on this Kutumba platform and be able to share some of what we do on a daily basis with all our Kutumba members. So thank you, Sudhakar, and also thank you to Santosh Goli also for giving me this opportunity. So I will be mostly trying to talk about some common topics related to cancer, mostly things that most people are interested in hearing. Not everybody wants to hear about latest treatments, that this and all that, but most people want to know kind of what is cancer, what can we do to reduce our risk for cancer, what is our risk for cancer. So these are some of the more common topics people are interested. So I thought that might be a good way to introduce this subject. So first of all, cancer andre eno, what is cancer? So we all know that, as we get older, we are going to get a variety of illnesses. But you may have noticed people can get, say, heart disease or diabetes or any other fractures or any other illnesses. Most people are able to deal with it in a very rational fashion. But once you hear the word cancer, there is a lot of fear, there is a lot of anxiety associated with that diagnosis. So it evokes some very strong emotions among people and their family members. So and why is that? That is usually because with most other illnesses, there's usually a set path, a set treatment plan, and most people are aware of how the disease might progress. with cancer, there's a lot of unknowns. There's a lot of fear among patients. There is also a lot of worry about all the suffering and all that disease can cause. And most importantly, most people are almost as worried or fearful of the treatments that cancer needs as much as the disease itself. So I think that is why this is a very relevant topic for us to be able to discuss, talk about some risk factors, and kind of educate people about what they can do to mitigate their risk. So that's kind of what I will be focusing on today. So basically, cancer is just a very simple concept. It is not one disease. It is actually a group of a lot of different types of diseases that we try to club under one big umbrella. So basically what happens is we have trillions of cells in our body that divide every day, every minute, every second. And I think more than understanding why we get cancer, I think it is more fascinating for us to understand why we don't get cancer, because these cells are dividing at such rapid speeds. It only takes one cell to divide in a wrong fashion to develop the cancer pathway. So I think it is really amazing every day of our life that we don't get cancer. I think that is more miraculous than when we actually do get cancer. The reason being, our bodies are blessed with an amazing immune system. So it's like a clearinghouse. So basically what happens with cancer is that there is one cell division that goes wrong. And instead of cells having this normal cell cycle where they grow, they divide, and they die, these cells are able to keep growing without being able to die. And they are able to escape all of the clearing pathways of our body. And as a result, they just keep growing. So that is basically what cancer is. And it can affect really any part of our body. So there's more than 200 different types of cancer, really can affect any part of the body, start in any part of the body, and can metastasize to any part of the body. So it is not possible to just say that cancer only affects this part of the body or that. So it really is a very widespread illness. Let me try to share my screen here. Give me 1 second.
Yep.
Give me 1 second. My daughter is working. The other one. So this is the big question everybody wants to answer. Is cancer, can it be prevented? In a nutshell, the answer is actually no. I think if your body is going to have cancer, I don't think there is any one thing we can do to prevent it, no matter what genetics you're born with, no matter what kind of lifestyle you're leading. There is no guarantee that you can actually prevent a cancer. So then what are some of the ways that we can mitigate our risk for cancer? That is something we are going to address today. So to understand that, it is important to understand what are some of the risk factors. What are some of the risks that we inherit and we live with that increase our risk for cancer? So obviously, it is a concept of a seed and soil. That is how we look at it. So genetics and our environment and our lifestyle. So it is a very complex relationship between these three factors that increase our risk for cancer. So genetics is important because that is the seed that we are born with. That is an individual signature that our body is born with. It is our genes that help determine what our longevity is going to be. So genetics certainly plays a risk. But to be honest, genetically inherited cancers are a very small percentage of overall cancers, most cancers are not inherited or genetically related. They are mostly because of our lifestyle and other risk factors. So the second biggest risk factor that we see for cancer across the board, across countries, across races, and across all ages is tobacco use. Tobacco use is one of the most common risk factors for cancer, and it can be tobacco in the form of smoking, cigars, pipes, vaping. We see a lot of kids doing vaping these days, thinking that a smokeless product is probably safer, but it is not. So tobacco, whether you're chewing it, vaping it, smoking it, is going to be a big risk factor for a variety of cancers. Most of us think of tobacco and lung cancer, so smoking and lung cancer, but smoking also increases the risk for other cancers like head and neck cancers, bladder cancer, esophageal cancers, and such. So that is potentially a modifiable risk factor. So that is something in our hands. So if we are able to mitigate that risk factor, we considerably reduce our lifetime risk of developing cancer. The third thing, which is probably a most relevant and prevalent risk factor in this day and age, is obesity. So obesity independently is a risk factor for developing a variety of cancers. And when I say obesity, it is not just, we have different ways of looking at body mass index, weight, and other things. I think obesity is way more complex than that. I think when we're talking about obesity, it also depends on body fat distribution. So, and the same thing goes for risk factors, even for cardiovascular disease. So when I say obesity, we talk about something called a metabolic syndrome. So what I mean by that is obesity where you have more fat around your midsection or abdominal fat, or visceral fat. So that kind of obesity is also an increasing risk factor. And I say that because a lot of people will tell me, well, my body mass index is normal. I'm not technically considered obese. So even though you're not technically considered obese, if your body fat distribution is in that metabolic manner, then that does increase your risk for cancer. And the next one is a poor diet. So what is a poor diet? And I'm going to address this in a little more detail because I get asked this the most commonly, is there a diet that I can eat that will reduce my risk of cancer? And I will address this in a little bit more detail. But in general, a diet that is high in things like processed foods, processed sugars, red meat, processed meats, all of these are more carcinogenic, and we will talk about some good dietary choices that might help reduce our risk of cancer. The next thing is also kind of tied in with obesity and metabolic syndrome is physical inactivity. And we have seen that in most of our populations here. Most of us have sedentary jobs, and most of us are sitting for prolonged periods of our day. And that in itself is also an increased risk factor for developing cancer. There are certain infections also that increase the risk of cancer. There are not as many, but there are certain ones, especially things like HPV virus that can increase risk of cervical cancers. There are certain hepatitis viruses that can increase risk of liver-based cancers, HIV-related cancers. So there are certain infections that also provide an increased risk factor. So once we understand some of these risk factors, it is then more easy for us to see what can me as an individual do to reduce my risk of developing cancer in my lifetime. So to modify risk, there's a lot of interventions that we can undertake. And a lot of times it is not what you do, it's what you don't do. That is kind of what we need to focus on. So like I said, number 1, 2, and 3 on this list is going to be to avoid tobacco in any form or fashion. So that is going to considerably reduce your average lifetime risk of developing cancer. The second most important thing is physical activity. I just talked about how, we as a population, especially in this day and age, most of our work is sedentary. We are not like our, generation before us who used to do a lot of physical activity. All of their work was manual. Now all of our, work, our homes are automated. So there's a lot of inactivity, and we tend to sit for prolonged periods of the day during our day. So this does increase the risk of cancer. So American Cancer Society does recommend at least 150 minutes a week of moderate aerobic activity to reduce the risk of cancer. We in general also advise people to at least focus about 30 to 40 minutes a day with some form of brisk aerobic activity that would probably increase your heart rate a little bit. So it could be as simple as going for a walk or bicycling or something very simple. It does not have to be very intense. People these days are, very much into, some people are into fitness. So there's a lot of these high intensity exercises. Well, it might be good for some people, but that is not something we would recommend for all people. And that is not something that's needed. So a moderate physical activity, at least 150 minutes a week, has been shown to considerably improve your health, reduce cancer risk, and also reduce cardiovascular risk. And that ties into maintaining a healthy weight as well. I think that goes hand in hand with the physical activity. As we talked about, being obese is an independent risk factor. So coming to diet. So this is something that we get asked a lot. In fact, even after a cancer diagnosis, one of the first things patients want to know is there a diet that I can take that will help reduce my cancer risk? Or is there a diet that I can do that's going to help me get treated faster? So the short answer is yes, there are a lot of dietary changes that we can make that would help our bodies reduce the risk of cancer. And a lot of this is, again, tied into maintaining a healthy body weight, avoiding obesity. So a healthy diet usually would involve a diet that is rich in fruits, vegetables, whole grains, low saturated trans fat, avoidance of red meat and processed meat. So if you have, heard some of the previous talks here in our Kutumba, I think we had a nice talk about a month ago about, diet. And I'm sure most of you have heard about this thing called a Mediterranean diet that has been shown in many studies over and over. Mediterranean diet usually involves a lot of fruits, vegetables, whole meats, whole grains. That has consistently been shown to have a favorable risk with respect to cardiovascular disease and cancer. So in contrast, what we call a Western diet. So what is a Western diet? And I don't want to be politically incorrect. A Western diet is something that we consider that has a lot more processed foods, a lot more processed sugars, enriched grains, not whole grains. So these are the kind of diets. And why are these kind of diets going to cause an increase in cancer? Because these are very inflammatory diets. So overall, when you have a diet that is high in processed sugars and enriched grains and red meat, these are inflammatory diets which cause your body to have some inflammation chronically. And when your body is constantly fighting that inflammation, it is more likely that there will be some cells that divide in a wrong way and can result in cancer. So I think this, especially for our, Kutumba people, I think this is important because I think in general, as a community, I think we as a community here probably follow this healthy diet, and I don't think our diets are very Western. So I think this would be a very important take-home point is to, if you're going to take home one thing about diet, is to make your diet as plant-based as possible, as natural as possible, and as less processed as possible. So these would be some of the main things you would work on. I have a lot of people ask me, is there some supplements we can take? Are these vitamins, these extra turmeric and curcumin? So there's a lot of things that go around. If you look at WhatsApp every day, I get hundreds of messages. Every day there's a new cure for cancer. Every day there's a new supplement that's come out that's going to prevent cancer. That's not how that works. I think it is something you do over a period of time. There is no one supplement or a magic vitamin or something that is going to prevent cancer. The third thing, or the fourth thing, is to limit alcohol. So this, again, is also a very important thing in terms of avoidance of many types of cancer. Cancers of the GI tract, like esophagus, stomach cancers, liver cancers, a lot of these cancers increase in incidence when there is, steady alcohol activity. And I'm not saying don't enjoy a glass of drink, drink with your friends or social drinking. We're talking about some form of a daily alcohol use. I know from time to time we, get studies out there saying a glass of wine or two is good for your heart, and then 2 years later another study comes out and say no, the wine was not good for your heart. So these kind of things, there are a lot of trends based on small studies, but in general, limiting alcohol is going to be very helpful in terms of reducing your risk of cancer. The next thing that doesn't get talked about as much is sun protection. So especially, I live in Texas, so we get a lot of sun about, 10 months of the year. So unprotected sun exposure increases the risk of a variety of skin-based cancers, including basal cell carcinomas, melanoma. So different types of skin cancers are increased when you have unprotected sun exposure. And this is a very, very easy thing for us to practice. Sun protection, whether it's barrier protection, where you're wearing clothing that's going to protect your skin, or more importantly, using some form of SPF, at least 30 or more, when you're going to be in the sun for prolonged periods of time. So these are some of the things we can do to reduce our risk of cancers. The next thing I wanted to touch upon is vaccinations. So vaccinations are very important. And this may also be one of the reasons why in some of the developed countries, we are seeing some of the lesser incidences of certain types of cancer. Vaccination for HPV is done routinely in this country for all children as they get into the adolescent or sexually active age. So HPV vaccination is a huge step in terms of reducing the risk of cervical cancer. So that is very important. Hepatitis B vaccination is also part of vaccination program here in the United States. So that also causes a considerable decrease in liver-based cancer. So these would be some of the important vaccinations that one needs to be aware of. And last but not the least, and this is probably the most important part of cancer prevention, is no matter how much physical activity you do, no matter how healthy a lifestyle you lead, really the most important thing to early detection is to go in for regular screening. And this is something that is very important because it makes a huge difference when cancers are detected early as opposed to when they are detected at a later stage. This may also be the reason why in some of the not so developed countries, we see higher incidences of cancer, higher deaths related to cancer. So if you get screened on a regular basis, the chances of a cancer getting detected early is much higher. And pretty much any cancer that is detected early is potentially curable. So it can be the difference between a curable cancer and a non-curable cancer is just how quickly you were screened and you went in for that. So I am going to spend a little more time on my talk about screening because that is something I'm very passionate about, because we see the difference. Somebody comes in with breast cancer. If it was something that was picked up on a mammogram, the patient did not have any lumps or anything, the treatment and the prognosis for that patient is so much better than somebody who found a lump themselves and it's now big and now we got to treat them. So cancers that present at a later stage are much harder to treat. The treatments are more complicated. The treatments come with a lot of side effects and their prognosis is much poorer. So regular screening, age-appropriate screening is something I think is most important in terms of, improving our odds with respect to cancer treatment. I'm going to share a different screen right now. Give me 1 second. Yeah. So let's look at the other one. The other one. So sorry about that. I have my daughter who's helping me. She's like my technical support. So sorry about that. So let me talk a little bit about prevention. So I'm going to talk a little bit about some of the more common cancers that we see among our population. And I'm trying to focus a little bit more on our kind of South Asian or Indian population, some of the more common cancers. And we're going to talk a little bit about what is the best way of prevention of these cancers. So in men, the top 3 types of cancers that can occur in your lifetime is going to be prostate cancer, lung cancer, and colon cancer. So these would be some of the things we will focus on. For women, the most common types of cancer that occur in our lifetime would be breast cancer, lung cancer, and colon cancer. So prostate cancer is one of the most common types of cancer in men, and it is called as a silent killer because most patients that have prostate cancer initially do not present with any symptoms. And a lot of times, if you wait until they have a symptom, most of the times the cancer is detected in very late stages, and that is not considered curable. So what are some of the risk factors for prostate cancer? Obviously, age. So it is typically a disease of older men. So typically your age after 50 or 60, your risk of prostate cancer increases. Obviously, if there is some kind of a family history, that increases your risk of prostate cancer. So how are we going to detect this? So talk to your doctor about this. I think every individual man over 40 years of age should talk to their primary care physician so that they can screen you, what is your risk, and assess, what would be the best screening protocol for you. And that has different ways of screening for prostate cancer. There is a test called a PSA test, which is a blood test that can be used for screening of prostate cancer. There's been a lot of literature about what age to do it or not, but it is something I would encourage you to discuss because it is very dependent on the individual person and what their provider suggests. So there is something called a PSA test that they do. There's also something called a digital rectal examination, which doctors typically will do when you go in for your routine physical after a certain age. So these are some of the things you need to have on a regular basis. So it's not enough if you just at 40 years of age go for one physical and then not go to your doctor for the next 5 or 6 years because you're feeling fine. I think it is something you have to be proactive and do on an annual basis. So this is something as well that we recommend. These are some of the symptoms that can happen with prostate cancer. So if you have any of these symptoms, try not to avoid or procrastinate or ignore these symptoms, especially after the age of 50. These symptoms would warrant further evaluation. So typically, what age do we start, doing all of these screening? For most, what we call average risk people, we recommend some form of prostate screening, certainly at around the age of 50. So around the age of 50, you have to start talking to your doctor about whether you need to have a digital rectal examination or a PSA test, and your doctor may suggest what, is the best test for you for screening. Certain high-risk patients, let's say they have, their father had prostate cancer, their brother had prostate cancer, or if they are known to have certain genetic mutations that have, risk for cancer, for those patients, we actually start screening them earlier than an average individual. So that is why when you go to your physical, your doctor usually will ask you, is there any history of cancer in your family? So that is why we want to know that so we can assess what your risk is. So for prostate cancer, it's a very screenable disease. And if detected early, is very, very treatable and has an excellent prognosis, as opposed to waiting until the cancer has spread. So this is a cancer that we highly recommend that men be aware of for screening. The second most important cancer for both men and women in our race and age demographic is colorectal cancer. It is uniformly the second leading cancer killer for both men and women. Most kind of cancers of the colon and rectum are diagnosed in people 50 and over, so age is certainly a risk factor. However, diet plays a big role in development of these cancers. So like I told you before, smoking, heavy alcohol use, diets that are rich in red meats, processed meats, processed sugar. These are all kind of things that increase your risk for colorectal cancer. There are certain bowel diseases called ulcerative colitis, Crohn's disease. These are some of the bowel diseases that also increase risk for colorectal cancer. And of course, there are some colon cancers that are inherited because of certain genetic syndromes. Again, genetic cancers are very, very rare. Most cancers occur mostly because of lifestyle and environmental factors. Again, colorectal cancer is, if detected early, has an excellent prognosis, high chance of being cured with very minimal treatment. And if detected at later stages, it is exactly the opposite. The treatments are very complicated. Prognosis is very poor. Treatments have a lot of side effects. So it is another cancer that we highly recommend that patients get screened for. The screening for colorectal cancer is a little more complicated than just going and getting a blood test. It involves something called a colonoscopy, which most people don't like to have. I think the procedure itself is okay. It is the night before, you have to take a prep, what's called a bowel prep, that helps you get all your stool out of your system. So it's going to be a lot of diarrhea. So most people are not very happy about having to do a colonoscopy. But that being said, I think it is a very important tool to detect these cancers early. Colonoscopies done at the right age can detect cancers 5 years before, up to 5 years before the cancer actually develops. So even detection of polyps during a colonoscopy and removing that is a very great tool to prevent cancers. So colonoscopies can detect these cancers many years before the cancer actually presents itself. So this would be another big take-home message. Currently, the American Cancer Society has recommended that starting at age 45, all men and women have to be screened for colon cancer. There's a few different ways of doing the screening, and that is something your doctor can talk to you about. There are some newer stool-based tests that they do for screening, but I still personally not too keen about doing the box or the stool test. I think a colonoscopy is still a gold standard for doing cancer screening for colorectal cancer. So if you are somebody who is 45 and older, definitely please talk to your doctor about getting a screening colonoscopy if you have not already done that. Now, that is a pretty broad rule. However, if there are some risk factors, like we talked about, you have inflammatory bowel disease or a family history, your doctor might recommend screening at an earlier age as well. So screening guidelines, like I just told you about, this is just a pretty self-explanatory slide. And you can see here, there's a few different types of tests that they talk about. There is a stool-based test that checks for blood. There is a stool-based test that checks for DNA. But really, what is like a gold standard test is a colonoscopy that you have to do. And your colonoscopy is not something you have to do every year. If you do it once at age 45 and it's normal, you can wait another 10 years before doing your next colonoscopy. So this is something I strongly advise for you all to talk to your physicians about. Certainly age 45 and above, talk to your doctor about a colonoscopy. Of course, the most important, there's no cancer talk that can be completed without talking about breast cancer. Breast cancer is obviously one of the most deadliest cancer among women across the world. Pretty much 1 in 8 women will be diagnosed with breast cancer in her lifetime. Early detection and treatment have steadily decreased cancer-related deaths and illnesses for many decades now. And the big breakthrough with that is getting mammograms. It is as simple as that. Getting mammograms on a timely fashion is one of the most fantastic tools we have to diagnose breast cancer early. A breast cancer diagnosed early is a pretty simple treatment. You may not even be sick for a day of your treatment. However, the same cancer diagnosed 2 years later or 3 years later, when it's already large and gotten into your lymph nodes and potentially spread elsewhere, that cancer treatment is completely different. So again, goes to show that no matter what kind of healthy lifestyle you're leading, it is still very, very important to get the screening tests done at a timely fashion. So these are some of the symptoms that we ask patients to watch for that could be suggestive of breast cancer. But ideally, we would like for you to have the mammogram or come to us before you develop any of these symptoms. Usually, if you wait until you have these symptoms, it is considered a little too late, and it's going to be mostly a more advanced stage of cancer. So again, basically, this just goes to show that early detection is the most effective way to fight cancer. Cancer screenings and risk assessments detect cancer when it's most treatable, and it also increases your chance of surviving cancer and curing the cancer as well. So this is some of the screening guidelines. This is for women with what we consider average risk. So there are a lot of online tools. If you're interested, you know, if you can shoot me an email or send me a message, I'll be happy to share those tools. You can plug in very simple things like your age, your family history, the age when you started your menstruation, whether you're postmenopausal, what age did you have menopause. There are some very cool online tools where you can put all this information, and it actually gives you what is your lifetime risk of developing breast cancer. And they're pretty good tools to use. So this is something you can discuss with your doctor as well. For most women that have average risk, we do recommend at least doing a monthly self-breast examination and report to your physician if there is any consistent changes that you've noticed. Women in their 20s and 30s, we recommend that they have a clinical breast examination every 3 years. So what is difference between a clinical breast examination and when you do a breast exam yourself? A clinical breast examination is done by a physician. So they will be doing a certain way of doing a breast examination. So they will be able to detect if there is any abnormal texture, density, anything that might need a mammogram, because typically the age of starting screening mammograms is 40 years and older. So we typically do not do mammograms in younger women. So it is still advisable when you go see your gynecologist every year for pap smear or something, make sure you get a clinical breast examination at least every 3 years. Now, women in their 30s, before you're ready for your mammogram, there are some women that may not just be enough to have a mammogram. They may have to have additional types of tests called breast MRIs and things like that. That is not for everybody. That is only for women who have certain risk factors, inherited risk factors, or something called dense breast. So there are some women for whom mammograms are not enough, and your doctor might advise that you need to have something called a breast MRI for screening. But this is something you want to actively engage with your doctor about, so they can tell you what is the most appropriate screening tool for you at your particular age. So again, this is just a summarizing statement about everything that we just talked about. Another thing I wanted to briefly touch about before we kind of go into the question answer session is that we are an immigrant population. We are originally from Southeast Asian descent, and we are currently living in a Western world. So what is our risk compared to the average risk of the population here? And you know, we like to think that, you know, most of us have good diets, most of us are not very smokers, so those incidences are lower. So we may actually have a lower risk of cancer, but that is not true. In fact, even things like cardiovascular disease, people of South Asian descent have a higher risk for developing cardiovascular disease. We also see that the risk of cancer also is I would not say it's higher, but it is almost the same as the other races. So it certainly doesn't have to do with any genetic makeup or anything. It purely has to do with our lifestyles at this point. So again, coming to a Western country, I think our diets have changed considerably compared to the diets we have had back home. There is probably more processed foods, processed sugars, way more than what we used to consume back home. So that certainly increases our risk for cancer. Also, our physical activity has considerably decreased compared to previous generations. So it does increase our risk of cancer. So I don't think we can be complacent saying that I'm vegetarian or I don't smoke, so I don't have a risk for cancer. I think we have to be cognizant that our risk is as much as anybody else, and be proactive about that. In fact, we are also seeing that even in India, we are seeing a considerable increase in cancer risk and diagnosis. Initially, it was felt that there was not as much cancer in India, and now we feel like, oh my God, suddenly there's a lot more cancer we are seeing. I don't think that is 100% accurate. I think it also depends on how robust the screening protocols are in each country. I mean, in this country, the screening protocols are very robust. So we do pick up a lot of cancers early. So it feels like the cancer incidence is more. In a lot of countries where the screening protocols are not robust, most cancers are picked up at later stages in symptomatic patients. And also it depends on socioeconomic conditions as well. A lot of patients that in a developing country may not have the access to cancer-based care. So I think some of the statistics about how much cancer is in India versus here is probably skewed because of some of those screening and access to care issues. That being said, it is pretty obvious that the incidence of cancer is continuing to increase at a rapid rate, even in countries like India. And that purely has to do with, again, our lifestyle. Sedentary, being smokers, there's a large increase in smoking population, and there's a larger increase in people that drink alcohol and bad diet. So I think it is a combination of a lot of lifestyle modifications. And the third most important thing why we're seeing a lot more cancers is because our life expectancy has increased. Cancer is usually a disease of older individuals. So as you're going to see a more aging population, you're going to see more cancer. So I think that also is something you have to take in mind. So I think as a population, what we need to take home is that there is no one magic wand that can help you completely prevent cancer. It is something that you have to work on day in and day out. It is not something that's, I do it for 6 months and I'm done. It is a lifelong thing that you have to work at. Again, there is no such thing as preventing cancer. I think the idea is to maintain a good body weight, a good physical activity. And not only does these interventions reduce your risk of cancer, even if you develop a cancer, these kind of lifestyle choices will help you fight the cancer better. It helps you tolerate the treatments better, and you will have a better outcome with the treatments as well. So I think lifestyle modification is going to be something we all have to work on day in and day out, hopefully for the rest of our life, in order to reduce our risk for cancer. So with this, I am going to stop and see if there are any questions that I can take.
Thank you so much, Dr. Shreedhara, for a very informative session, very relevant and very targeted discussion as it applies to what risk factors are for our community. So certainly do appreciate the focus on cancer as it pertains to our community, and more importantly, some of the key takeaway messages from you, meaning healthy lifestyle, which is, this day and age, it's very different from what you're accustomed to. And I think one of the important things that we all should also take away is educate our next generation, because their lifestyle is, again, very different from what we are accustomed to. So some of the key messages that were delivered in the session today is very relevant and appropriate to take to our next generation, and importantly, share with our family back in India as well, because the more we know, the more we share. I think, as she pointed out, uh, it just increases our chance of reducing the risk of contacting cancer. So with that said, please again use the chat feature in Zoom for your questions, and I'll read the questions out and have Dr. Shreedhara answer as many questions as possible. The first one I think you answered as well, but I'll go ahead and ask anyway, Dr. Shreedhara, is what's your advice on Cologuard screening? Because that's something that we have been hearing lately on the news channels.
Yes. So let me, first, for people that don't know what is Cologuard, let me tell you what Cologuard is. So Cologuard, we talked about colon cancer screening, where, you have to go get a colonoscopy to find out if you have cancer or polyps and things like that. So Cologuard is kind of like a shortcut test. Basically, what it does is it takes a little stool sample and checks to see if there's any cancer-related DNA that is being shed in the stool sample, and it kind of comes like a little box, and basically it checks to see if there's any cancer DNA in the stool. So it's like a poor man's colonoscopy, if you would. Let's say you're too ill to have a colonoscopy, or an anesthesia risk, or you just don't want to have a colonoscopy. It is possibly one way of doing some form of screening, but it is not 100% screen, because there is a lot of false negatives with that. And worst case scenario, if your Cologuard test comes back positive, guess what you're going to need? A colonoscopy. So it really doesn't completely negate the need for a colonoscopy, but it is probably something that you can use after you've had your initial colonoscopy, and you go, they tell you your colonoscopy was clean, there was no polyps, come back in 10 years. Maybe in a few years, you can do a Cologuard. So I don't think a Cologuard is something that is going to completely replace a colonoscopy. It may have a small role in doing it for people that either don't want to have a colonoscopy or have barriers in terms of not being able to access a gastroenterologist. They're living in a rural community. So it's probably a fairly simple way of screening, but it is not as 100% accurate as a colonoscopy.
Thank you, Dr. Ore. If you're still sharing the screen, Shreedhara, you can perhaps stop sharing.
Okay, I'll do that. Yeah.
The next one coming up is exposing to sun is good for vitamin D, is what we hear. Do we still need screen protection?
Yes, that is actually a very good question, because vitamin D in itself is a very essential ingredient for our bodies. In fact, vitamin D deficiencies can cause a variety of illnesses, lower your immunity, may even increase your risk for cancer. So how do we balance, sun protection versus getting vitamin D? I think in Texas, living in Texas, I do not think we have to worry about getting enough vitamin D. I think most of us, especially if you don't live, stay indoors all day, we would have a good way of getting vitamin D. Sun protection is still important, because you can still get vitamin D if you wear sunscreen. It's not that you will not absorb vitamin D. There are other ways of getting vitamin D as well. There is dietary supplements that you can get vitamin D from. There is dairy products that you can get vitamin D from. So our recommendation is don't discard the use of sunscreen so you can get vitamin D. I don't think that is a fair advice. It is still important for sun protection, especially in states like Texas, Florida, where there is very much of a high sun many months of the year. So vitamin D, there's different ways of getting vitamin D. So we still recommend some form of sun protection if you're going to be out in the sun for long periods of time.
I'm hearing a lot of messages coming through about how informative session this was. Again, thanking you for your valuable time and the insight that you presented here. A few other questions coming up is how often should one have a colonoscopy if there is family history?
So if there is a family history also depends on whether it was your first degree relative or who it was. So let's say you have an uncle or a great uncle or a grandfather. That's not as relevant of a family history as if you have like a parent or a sibling that has colon cancer. So if you have a parent that developed colon cancer before the age of 50, that puts you at a higher risk of developing colon cancer. And for those people, we don't recommend waiting until they're 50 years of age. We recommend screening 10 years before when their first degree relative developed cancer. For example, if your father developed cancer when he was 50, then you would need to start screening around age 40, not wait until 45 or 50 like the other population. But let's say you have a family member that was diagnosed with colon cancer when they were 75 years of age. That is not considered a significant family history, because most inherited family history cancers occur before the age of 50. So if you have a first degree family member that developed cancer before the age of 50, that is what we look for as physicians in terms of screening early. If not, for most people, 45 years of age is the recommended age for colonoscopy. And how frequently you need to do it after that depends on what they found during the first colonoscopy. So if they found no polyps, everything looks great, then they will usually tell you come back in 10 years. But if they removed a few polyps and some of those polyps looked ugly, they were kind of looking like they were turning, cancerous, they may have you come back in 3 to 5 years for another colonoscopy. So the initial is 45, but after that, it depends on what your first colonoscopy looked like.
Thank you, doctor. The next one relates to sunscreen as well. So is coconut oil a preferred solution to applying sunscreen? Because we have heard that sunscreen itself in certain cases does cause cancer.
So no, coconut oil is not a sunscreen. So I can maybe a pretty short answer to that. Coconut oil is a lot of great uses for a lot of different things. In fact, I also advise using it for cooking and stuff, but it's certainly not a sun protection. It does not protect against UVA or UVB rays. So I do recommend using sun protection with some SPF, at least 30 or more. I certainly don't think you need SPFs of 70 and 100, and you get crazy sunscreens in drugstores these days. I don't think you need that kind of sun protection unless you're doing some kind of sporting events or something like that. But coconut oil is not a substitute for sunscreen. And there was some recent studies about some ingredients in sunscreen that were also considered carcinogenic and such, but those are some small studies based off of, small groups of people. I don't think that is something that a recommendation for, it's not a one size fits all. In general, sunscreen does help reduce the risk of skin cancers. And the more convincing thing I use to tell my patients is forget about skin cancer. It will reduce your risk of aging from sun as well. That is more, people like to take that advice more than cancer advice. So if you tell them you're going to age slower if you wear sunscreen, they're more likely to, wear sunscreen.
That's a good tip. The next one is, what are your thoughts on diabetes and its impact on cancer? Does it increase the risk of
Yes,
contracting
I
cancer?
think so. And it's not a direct correlation between diabetes and cancer. I don't think diabetes in itself increases the risk factors for cancer. It is what led to the diabetes. Is it because you're obese? Is it because you have a metabolic syndrome? Is it because you have abdominal fat? So the risk factors that you end up developing diabetes are similar to the risk factors of having cancer. So if you have uncontrolled diabetes, then you are going to be more likely to develop some form of cancer. But that doesn't mean having diabetes will increase your risk. If you have diabetes and you keep that under good control, I don't think that in itself would lead to any increased risk of cancers.
Thank you. Could you touch upon screening with CT scans?
Yes, so there are certain, and I didn't bring up lung cancer here because I just assumed we do not have a very large smoking population in our kutumba. I just assumed that. But a screening with CTs is routinely done for lung cancer in smokers. So it is not recommended to do CT screening for any other type of cancer because you have to understand every time you get a CT scan, you are putting a lot of radiation through your body. So we certainly don't recommend everybody to get a CT. So if you're a smoker having, certain number of packs a year, smoking history for more than 15 to 20 years, yes, we do something called a low dose CT screening for those patients. And that is typically to screen for lung cancer. We routinely do not use CT screening for any other types of cancer.
The next one is an interesting question. The use of plastics, which is kind of increasing lately, and some of the warning labels that go with the plastic that says there is a chance that it can lead to cancer. What are your thoughts on that?
So yes, I think plastic is everywhere, and microplastics, I think we are drowning in microplastics. I think it is in the air we breathe, in the food we eat, in the water we drink. I don't think we are able to, at this point, control the amount of plastic or microplastics in our environment. I certainly think that that is going to play a bigger role in our future generations in developing cancers. But I don't think it has to do with somebody asked about floor mats or any kind of contact exposure to plastic. think of it more like, let's say you have a plastic container, you're microwaving it in the microwave and eating directly from it. Those are the kind of chemical changes that are more considered to be carcinogenic than just using plastic, footwear or Tupperware, things like that. And I think more than plastics itself, it is the microplastics that we need to be worried about. That is going to be everywhere. So I think that is something we have to see over the next few decades, how it is going to impact us. We are worried about it, but we don't know what the true impact of that is going to be.
The next one, I think, goes to visiting a dentist and where they use X-rays. So what is the risk of
Yes,
contracting
so I
cancer
will be
from that?
also, this is a very good question. It comes up quite frequently. Dental x-rays are very safe. They have a very, very small amount of radiation. Probably it's 1/100th of the amount of radiation you would get on a CT scan or things like that. So dental x-rays, your panoramic x-rays, your orthopedic x-rays are considered very safe. So they do not increase a risk of cancer at all. So please go to your dentist. In fact, not having dental x-rays and having cavities and caries and gingivitis is going to be more likely a risk factor for developing head and neck cancer. So no, dental x-rays do not cause any increased risk of cancer.
Yeah, for the folks on the call, we did have an oral health session last month, and the recording was sent out as well. So that was a very informative and useful recording and session as well. The next one, I think sunscreen seems to be a very interesting topic. So are the chemicals that go into making sunscreen safe in terms of being carcinogenic?
In general, yes. So whenever we, either eat something or apply something or, consume something, you want to know whether the benefit is more than the risk. So I don't think there's anything that is 100% safe, probably not including the food we eat. There's always a risk associated with everything and every chemical. But in general, the benefits of wearing sunscreen far outweigh any minor, carcinogen products or anything like that might be there. So as long as you're using a sunscreen from a reputable brand, I don't think there is going to be any carcinogenic risk. I personally have never seen any skin cancers or any kind of condition that has been directly attributed to sunscreen. In fact, we have seen more cancers because people have not been using sunscreen. So I would still, be a huge advocate for using sun protection. So the risks that, they talk about, carcinogens is very, very minimal. And every, week you open the news, there's going to be a shampoo that they found carcinogens or this. So it doesn't really pan out. These are usually small studies done on a small number of patients. It doesn't really pan out. That's something we can apply to all people. So if you want to take home some message from here, sunscreens are safe, highly recommended. You will not age as quickly and you will not get skin cancer if you use sunscreen.
The next one pertains to cervical cancer screening for women. What age you would recommend that they
Yes,
get a
cervical
screening?
cancer screening needs to start at a very early age. So for most women, as soon as they get sexually active or get into the reproductive age, cervical cancer screening is recommended. And most of you, when you go to your gynecologist, they will do that as part of your screening. They do something called a pelvic exam and a pap smear. So that is the most common screening tool used for cervical cancer. We now have a lot of advanced versions of pap smears. Initially, we used to have women come every year to do pap smears. Now there's a lot of thin pap smears and advanced pap smears where, so if you have it, one normal pap smear, you could probably wait 4 to 5 years before doing another pap smear. But that is something women need to start at an early age as soon as they start getting sexually active.
The next one pertains to professional hazard, work hazards. So is there any specific work environments that was more prone to cancer? Because this gentleman here had one of his friends who worked closely with laser machines that
Right. So
contracted.
yes, there is a lot of industry chemicals that, especially the ones that employ arsenic, mercury, and things like that. But again, it is not the chemicals as such. It is also most factories, at least here, are required to provide their employees with some form of safety gear, protection, masks, goggles, protection. So as long as they're using protection, if they're working in industrial environments, we have not seen any increased risk of cancer, even with industrial chemicals. So it also depends on how protected or unprotected the person was during their employment. And it also goes to, I see this quite a bit. We have patients that have smoked 2 packs a day for 40 years, but they then want to know if that 1 year they worked in some factory was what caused their lung cancer. And I'm like, no, that's not what it was. It's probably because you smoked for 40 years. So I don't think that would be a direct correlation. So that being said, I think it's very important to use protective gear, especially if you're working in an industrial environment. Like, for example, we work with radiation quite a bit. Radiation does increase risk for cancer. So we have to wear lead belts and, lead equipment whenever we're going to a radiation machine. So even though there is a risk of cancer, if you understand it and use protection, then that does reduce your risk.
Your thoughts on autoimmune disease, does it lead to a higher risk of contracting cancer?
Yes, it can. So there are certain autoimmune diseases that are associated with certain types of increased risk of cancers. For example, things like rheumatoid arthritis and lupus can be sometimes associated with increased risk of lymphoma. And that just goes to tell us how important our immune systems are in terms of preventing cancer. So if we have a disorder that is based off our immune system, that's what most autoimmune diseases are. It almost tells you that you are less than normally protected from cancer prevention. So yes, people with autoimmune diseases have a slightly higher risk of developing cancer, have to be probably more cognizant of any new symptoms, and be in regular touch with their doctors.
I think we have time for 2 more questions.
Yeah.
Okay. The next one, if both parents have been diagnosed with cancer, what are the chances that the offspring might contract cancer as well? Are they at a higher risk?
Again, it depends on what age the parents were diagnosed with cancer. Just if one or more of the parents were diagnosed with cancer before the age of 50, yes, I think that does increase the risk of cancer in the offspring. But if both parents were diagnosed, later in age, it could be due to a variety of factors. But yes, in general, if you have both parents that were diagnosed with cancer, that is something you discuss with your doctor, depending on what type of cancer, whether your parents were smokers, non-smokers. There's a lot of things that would go into that. Then your doctor will decide if you need to be screened earlier than average or not.
And
so
this will be the
family
last.
history, yes, does play a role.
Thank you. And this will be the last question for tonight. And it goes back to Ekadashi and Upavasa. And it started with what you started earlier when you opened the conversation is about how cancer is from multiplying cells and a mutation and variation. So what are your thoughts on fasting and these things like Ekadashi and its contribution to cancer?
I think, we are now, everybody talks about intermittent fasting and all of that, which is great. But I think our culturally, we have been doing this far longer than before everybody else discovered intermittent fasting. I think all of the Ekadashi Upasas were pretty much some form of intermittent fasting. I think intermittent fasting has a lot of benefits. It certainly reduces inflammation in the body. It is a very effective tool in weight management. And if done properly, it can also reduce body fat percentage. So yes, Ekadashi is, I think, just the old version, and the new fancy word for that is intermittent fasting, which all of you are familiar with. So yes, I think that there is a lot of benefits to that, if you can do it in the right way.
Thank you.
Fasting
and I think
doesn't mean you fast for 12 hours and then after that you go eat all kinds of
binge
bad
eating.
stuff. That is not going to help. That is why I said if you're doing it in the right way, yes, it has a lot of health benefits.
All right, I think that pretty much wraps up the Q&A for tonight. Again, thank you, Dr. Shreedhara, a very informative session, very targeted, and I'm sure I'm speaking for our community when I say that this is an excellently done presentation, very informative. Again, a lot of disinformation and misinformation out there, but I think you navigated that and helped clear some of that mist for us. Thank you again so much for your time. Thank you for all our Kutumba members for coming and participating. Just mark your calendars. Our next health session is on May 14th on the topic of cardiovascular health. And any parting comments, parting thoughts, Dr. Shreedhara, before we wrap the night up?
Well, thank you so much. I actually really enjoyed this very much. I think we have a very active Kutumba members who were very nice enough to join. And it's a weekday, and I understand that. And thank you for joining. And I also enjoyed all the questions everybody posed. That was made it a very engaging conversation type of talk rather than just me just talking about the same things. So I thought that was very nice of everybody to join in and ask questions. So again, if there's anything specific I can answer for you, I'm just a WhatsApp message away, and you can certainly I'll be happy to engage with any questions. But I actually enjoyed this as much. So ಧನ್ಯವಾದಗಳು ಎಲ್ಲರಿಗೂ for providing me this platform. So really enjoyed it.
Thank you, Ore. And again, we'll wrap the night up. Shubharatri, Shubhamastu, and Elrigo Yugadido Shubhashagalu and Yugadido Namaskaralu. So we'll
Namaskar.
catch up again next, this Thursday as part of our Shodasa Samskara series.
Yeah.
Good night, everyone.
Thank
Bye.
you.
Shubharatri.